Good morning, ladies and gentlemen, and thank you for joining us at Technological Solutions Limited for this webinar, Protecting Your Staff, Your Clients, Your Business, and Your Brand from COVID-19. I am one of your presenters, and I'm going to be joined by Dr. Wendy Gay Thomas, who is a medical doctor and biochemist with 20 years of experience and a focus on public health. And I'm Andre Gordon, an applied scientist, biochemist, and microbiologist with 35 years of experience in the field and a focus on the application of science to production. So why did we decide to do this webinar? Well, a few weeks ago, we became very concerned about the lack of information, misinformation, and in the cases where it was provided, sometimes lack of accurate information in the public arena about COVID-19 and the SARS-CoV-2 novel coronavirus. At that time, we foresaw that this lack of understanding was going to lead to major miscalculations and likely problems for the region and our productive sector. TSL is a 24-year-old company that's dedicated to the application of appropriate science and technology to support the productive sector in developing countries and to improve sustainable competitiveness. And so this fell well within our bailiwick. We have clients throughout the Americas and also in many other countries of the world, in Europe, some in Western and Southern Africa as well. And we provide a range of services to the productive sector, including food safety and quality systems, laboratory analyses, and training. And it's under the training rubric that we thought we would deliver this webinar to you. Of course, we cover a range of other subsectors, occupational health and safety, medicinal products, pharmaceutical products, and so on. And the manufacturing, export, and agriculture and distribution sector are amongst our major focuses. So because it is our focus to provide technical support to these firms, sectors, and countries, based on the best available science, we try to make sure that when we do this, it helps them to stay healthy, safe, and produce high-quality, safe products for the global markets in a manner that is sustainably competitive. This novel coronavirus pandemic, though, has challenged us to ensure that we bring additional information to manufacturers, exporters, distributors, the sectors and countries that we serve, so that the information to them will be timely, accurate, science-based, and trustworthy. And that is why we've put together this series of webinars, one of which was held just over a week ago, and now we have this one focusing on the productive sector. In order to pull the information together, we've done a lot of research. We stay on the cutting edge. We've also reached out to our key international partners to look at what they're doing, what their guidance is, and to make sure that our information is according with international best practice in the productive sector. Now, much of what we're going to share with you, we prepared from more than 2 weeks ago, and literally before we could bring it to you, a lot of our concerns have started to be manifested. So for example, we foresaw outbreaks happening in the food industry, and these have now come to pass. Here in Jamaica, for example, where we also saw some challenges arising, we have seen an outbreak occur at Alarica, a business process outsourcing center, and we've seen the impact that is having on the country. The BPO sector having been shut down, and the country, several parts of the country having been put on lockdown. And so when we look at what has happened in the food processing sector, in the US at Smithfield Foods Incorporated in South Dakota, which is a pork processing plant, more than 200 workers tested positive. At a JBS SA, a beef plant in Greeley, Colorado, and they do have, JBS SA has beef plants elsewhere as well. In the Greeley, Colorado plant, more than 50 workers have tested positive, 14 have been hospitalized, and 4 have died. in High River, Alberta, in Canada, there's been a major outbreak at one Cargill plant, while at another Cargill plant in Pennsylvania, 160 workers have tested COVID-19 positive and one has died. Finally, in a poultry processing plant, Tyson Foods Inc., in Camilla, Georgia, there have been 2 deaths amongst the many persons that have tested positive. What has been the cause for these outbreaks? Typically, it is because there are heightened risks to the entities because of the structure of the companies, how they operate, and just the proximity of a lot of the staff members to each other. These team members have no personal protective equipment, PPE. In many cases, they were not wearing face coverings or masks. The staff was working too close to each other. In many cases, they were touching each other. So the companies were not observing the appropriate social distancing. In cases where staff were not directly beside each other, they tended to be in front of each other, so that they were sharing the same air. They share very tight quarters in their staff areas when they're changing or when they're on break. And then when they do go on break to have something to eat, many of them are on break at the same time, so social distancing was often not possible. In addition to this, the companies had ineffective screening and sanitation measures in place, and critically, many of the team members were required to work even when they're ill, because if they didn't work, they would not get paid. And so these are some of the reasons that have led to this problem. We want to ensure that manufacturers, exporters, and distributors throughout the region are able to be aware of the challenges and to ensure that they have appropriate systems in place to deal with COVID-19. My colleague, Dr. Wendy Thomas, will now discuss with you some of the important facts about the novel coronavirus and COVID-19.
Thank you, Dr. Gordon. Key facts about SARS-CoV-2 and the disease it causes, COVID-19. SARS-CoV-2, or novel coronavirus, which produces the disease COVID-19, is no longer an illness for the elderly. We have found there are a significant number of persons getting ill and being hospitalized are young or under 45 years old. The majority of the transmission is being and will be done by asymptomatic persons, otherwise known as carriers. They may have the disease, but they will not show any symptoms. They will not get sick from it. Current research is also showing that healthy persons can be infected by transmission of the virus by aerosols and not just airborne droplets. This is what happens with a sneeze. Sneezes can have speeds of up to 100 miles per hour and produce 10,000 droplets, whereas a cough can have a speed of between 50 miles per hour and 100 and produce 3,000 droplets. Airborne particles travel several feet away during a sneeze or cough. Many are large and tend to fall after a few feet, landing on surfaces, up to 6 feet. The smaller microdroplets are produced just by talking or breathing. These stay airborne for much longer, 3 to 4 hours, and can go farther than the 6 feet. Microscopic airborne particles have been shown to last in the air for up to 3 to 4 hours after they are produced. The virus also survives on surfaces for varying periods of time. Note that not all sanitizers are effective against the novel coronavirus or SARS-CoV-2. And here at TSL, we recommend that you use hand sanitizers with a minimum of 70% alcohol to assure effectiveness. Other sanitizers with hypochlorite, hydrogen peroxide, and alcohol, and selected other active ingredients may also be effective. Dr. Gordon will now discuss how you can protect your staff, your brand, and your business from the novel coronavirus.
So as we deal with the novel coronavirus, and this is just a micrograph showing the spikes that give it the name of a corona, so it looks like a crown, that allow it to be very infective. As we navigate it, we want to make sure that manufacturers understand the risks that are associated with getting the kind of an outbreak in their facility that can cause, unfortunately, kind of shutdowns that we've seen, and the attendant risk to our food supply and also supply of other manufactured products. So just to give you a little bit of a background, Food Safety Magazine wanted, and this was about 3 weeks ago, wanted to find out exactly how the coronavirus outbreak was affecting food processing entities and what mitigation efforts they were employing. So they asked a series of questions and they had about 330 people give them responses, which are presented, summarized on the following slide. Many manufacturers said they had issues with their employees, variety of issues with employees. You will remember there were significant supply chain issues, 15% indicated that. Logistical issues, which are allied to the supply chain issues, were also a problem for 7% of these food manufacturers. Meeting communication was the big one, because of course everybody's used to meeting in person and communicating. We know, as we are doing with this webinar, have to be finding new ways to communicate. General distractions was a major consideration. People are unsettled, people are depressed, a whole range of issues that lead to the inability of team members to focus. And this would affect any manufacturer, whether they're involved in food or not. And then 20% indicated there were other considerations as well. This kind of presentation might not necessarily be true for your entity, but we think that more or less you will find some similarities, and certainly the whole impact of the COVID-19 outbreak on your team is going to affect your operation. And so you need to ensure that your staff and your customers are confident that you're taking active steps to protect them. And this will help to reassure them and allow them to focus on what needs to be done. So this is just an example of what we recommend as one of the minimum things you do to protect your staff. Your staff must have appropriate personal protective equipment. They must wear masks, be appropriately attired, and we recommend the wearing of gloves, as is shown here, whenever you are in a contact area where product may contact surfaces, or food may be contacted directly if you're in the food industry, or even other containers of product, certain personal care items. You want to ensure that you limit the contact between a person, any one of your team members, and the product that's going out. Another practice that some companies have used is to erect guards that protect both team members and other people that they are interacting with from having to breathe in the same air. Or Dr. Thomas spoke about the micro droplets. These droplets are emitted when you speak. So a guard, a plexiglass or other guard, prevents these droplets from exchanging freely between persons, as is shown here. Amongst the protection measures, though, probably the key one, and you've been hearing a lot about this, it is not a normal practice in many circumstances, but hand washing with soap and water for at least 20 seconds is critical. The virus has an outer coat that is very susceptible to soap. It's a lipid-based outer coat. So once you use soap, that coat tends to be stripped away, and then the virus degrades fairly quickly. You can get more effectiveness to the cleaning and sanitation process if alcohol-based hand sanitizer is used with soap and water. And if soap and water is unavailable, the hand sanitizer will also have some effectiveness. You should note though that if it comes to a choice, it is preferable to use soap and water, even if it's soap and water only. Individuals should also avoid touching the areas that have been mentioned, eyes, nose, mouth, and so on, with unwashed hands. Try to avoid persons who are sick. Sick people are recommended to stay home, which means that, as we indicated earlier, you don't want to insist on your sick team members coming to work. In fact, we recommend that companies put systems in place. It is better to pay hourly or daily paid or weekly paid staff. It's better to pay them to stay home than to have them come on site. This is very important. Clearly, coughs and sneezes need to be managed, and areas that are high touch area, frequently touched areas or surfaces need to be cleaned. That's with soap and water, or detergent and water, and disinfected fairly frequently. In fact, we recommend at TSL that you wash your hands every 2 hours or so. In some settings, it's every hour. In a manufacturing or distribution facility, we believe every 2 hours is sufficient, and this should be recorded. You should note that it's happening. Critically, it's important that packages are sanitized. Now, what this means is, if there is a risk that the package may be contaminated, if the team member handling it is not wearing gloves, you may want to consider how you potentially decontaminate packages when they're handled, and this should be done after hands are washed. So remember, you want to wash hands, make sure they're clean, put on the gloves, and then deal with the packaging. So how do you protect your business and your brand? Now, these next few series of slides don't go into great detail because each of these requires more thorough consideration, but what we wanted to do is make you aware of some of the things that you need to consider to manage the risk of COVID-19 in the manufacturing sector. So the first, health and safety considerations. How do you manage contamination? Do you have a robust system for determining the risk of a carrier coming into contact with your staff? Do you have a team member that may be in an area that is already experiencing community spread? Or is that person likely to come into contact with such a person? One approach that some entities are using is to check temperatures of visitors and staff. A key approach is to make sure that clothes that are worn on the exterior of the facility don't come into the facility, and this also goes for shoes. Shoes have been shown to carry a large number of contaminants, including the virus, into a production environment. All of these can be managed by using things like foot bath, changing footwear or other footwear decontamination procedures, and ensuring that all persons entering a facility go through a gowning area or an area where clothes that are worn externally are protected or covered prior to entering the facility. Now, there are some specific considerations outside of the general considerations for manufacturing. And these include, for manufacturers of chemical and personal care items, they have specific consideration. These are different if you happen to handle fresh produce, fruits and vegetables, or processed foods that have a kill step. You want to think about potential sources of contamination in either of these two settings. You want to think about surfaces that can become potentially contaminated. Critically is, how do you clean these surfaces effectively? How do you clean your workers' hands effectively? When workers change their clothing, how do you effectively decontaminate them? So this requires there to be specific considerations for cleaning of equipment, surfaces, clothes, and so on. And critically, where the product has now reached the stage, whether it's chemicals or personal care item or produce or food, once the product has now been put in the packaging, how do we handle it to prevent the risk of contamination to our customers and the distribution channel? Another specific consideration is, how do we deal with our suppliers? Now, there are many suppliers. I'll just give an example of one very important set of suppliers, those suppliers of chemicals and those persons who may be cleaning contractors. Do we have validation data, for example, for the effectiveness of the sanitizers that are being used? Do we verify that the sanitizer that's being used has the composition that is advertised? What is the active ingredient and what is the percentage? Do the persons carrying out cleaning and decontamination activities adhere to particular sanitation standard operating procedures? Or just general standard operating procedures if they're just cleaning and not doing sanitation? How do we verify the effectiveness of the actual cleaning protocols themselves? What is the medical status of the cleaning staff? Do the cleaners follow good personal hygiene practices? Do we know whether or not they're trained? And has the training shown that they're competent? These are some of the considerations that you would bear in mind when you look at cleaning and the chemicals used for cleaning by either our own team or cleaning contractors. Just to give you a couple of examples, and Dr. Thomas would have mentioned that the coronavirus can be effectively inactivated or destroyed by some surface disinfectants, such as 70 to 80% alcohol, or including ethanol or isopropyl alcohol, 0.5% hydrogen peroxide, that's 500 parts per million hydrogen peroxide, or 0.1% or 1,000 parts per million of sodium hypochlorite used on a surface for at least 1 minute. I want to look specifically at manufacturers involved in food safety. So this, in addition to many of the other considerations, the food safety considerations focus very heavily on personal hygiene practices. Hand washing is absolutely critical, particularly in the post-process area, once the product has already undergone a kill step. So anything that goes on the product or its packaging now is going to be available to cause potential contamination down the road. So hand washing and sanitizer use is very important. We need to take time to make sure our team members understand the do's and the don'ts of that. We want to make sure that the sanitizers being used for hand sanitation is effective. Also, we want to make sure that we manage and limit the contamination of surfaces. So for example, no talking. You want to enforce a no talking rule in all production areas. Once food is exposed, or both pre and post processing, there should be absolutely no talking, in addition to the wearing of face masks. You want to make sure, as we've just mentioned, that the sanitizers that are being used are effective. The Center for Disease Control and Prevention and the Environmental Protection Agency of the US has a list. This is a list we can make available. After the webinar is over, you make a request of us and we'll send the listing to you. Now, we spoke about the validation of the sanitation regimes. Is the sanitation regime effective against the organism being targeted? And then verification, is it being implemented in the manner that it was designed? And is that overall implementation assuring effectiveness? And finally, for food manufacturers and others, how do we manage the handling of potentially contaminated items? Packaging that's going to go into our warehouse and then out. As Dr. Thomas mentioned, the coronavirus survives on packaging, in some cases for up to several days. So we want to bear that in mind. How do we manage the clothing that our staff take off or others, and other such material? So having presented all of these to you, as I indicated, these are just to give you an indication of some of the considerations that manufacturers and people in the food processing and production industry need to bear in mind. And we hope you found this useful. Dr. Thomas will now summarize what we have discussed.
Thank you very much, Dr. Gordon. COVID-19 affects people of all ages, young and old. While more dangerous for persons with underlying conditions, healthy persons are affected as well. The majority of the transmission is being done by asymptomatic persons, also known as carriers, who are not and do not look sick. The virus is spread also by aerosols that may come from simply talking and breathing, as well as from a cough or sneeze and direct contact with contaminated surfaces. Microdroplets produced by talking and breathing have been shown to persist in the air for 3 to 4 hours and travel distances of over 6 feet. We here at TSL recommend a distance of 8 to 10 feet. Wearing masks in public, at work, and in general is mandatory in most countries now, and it is highly recommended. The virus also survives on surfaces for varying periods of time, including paper, up to 5 days, cardboard, 1 day or 24 hours, and plastic, 2 to 3 days. Note that there are no easy identifiable features of COVID-19 that separates it, distinguishes it from any other flu-like viruses. So be on the lookout for any flu symptoms. Not all sanitizers are effective against the novel coronavirus or SARS-CoV-2. There are effective approaches that can limit the likelihood of COVID-19 spread within a manufacturing facility despite community spread. Effective management of SARS-CoV-2 requires a comprehensive set of well-thought-out policies and practices implemented as a part of your crisis management or business continuity plan. Post-process handling of manufactured items, particularly foods and medicinal products, is critical to mitigate the likelihood of any risk of product or customer contamination. COVID-19 is not a 9-day wonder. We expect to be dealing with the effects of it for another 14 to 18 months. Initially, we will have a resurgence of infections after it initially subsides, so please plan long term. Protect yourselves, protect your friends and associates, and protect your loved ones by adopting the safe practices recommended. Do's and don'ts. Do ensure that your entire staff is properly trained and understand the nature of the SARS-CoV-2 virus, how it is transmitted, and how spread can be prevented. Do understand the background of your staff, where they live, what they have to deal with to get to work. Do implement effective screening, PPE, including masks, and effective sanitation regimes for effectiveness. Don'ts. Don't be misinformed about the reality of the problem, about the risk of pre- and asymptomatic carriers, and implement ineffective systems as a knee-jerk reaction. Do not ignore social distancing guidelines in your facility, and do not allow talking on the production floor. Don't allow the entry of visitors, contractors to your facility without proper screening.
We want to thank you at TSL for having been a part of this webinar. TSL, the science supporting your health, the science supporting your business. We've just put up on the screen and are very proud to announce as we come to a close, our third volume in food safety and quality systems in developing countries, which has just been published and is on the market. It's available on the 27th of April, which, although it doesn't mention COVID-19, deals in detail with some of the issues we mentioned for the food industry. Thank you once again for being a part of this, and we are open to taking any questions. We've also included at the end of this webinar some references. This is our website, www.tsltech.com, and you can find a wealth of information there about the company and other information as well. We're open to taking any questions which you may now have.